Okay, I'm just gonna do my room scan for my skills video. There's all my supplies, drill, everything. Alrighty.
I'm sure in some capacity, some kind of cardiology specialty we care more about.
Hi Joe, my name is Danielle. I'm going to be your student nurse today. I performed hand hygiene and privacy. Can I get your first and last name and your date of birth? All right.
Oh, yes.
And are you allergic to anything? Just sulfa. Okay, I'm just checking your wristband, and I'm gonna put you up in a high Fowler's position. So today, looking at provider's orders, I'm going to be placing a NG tube for your GI bleed. Is that okay? Awesome. Have you ever had an NG tube before? Move my computer here. Okay. That's better. I'm just gonna raise the bed just so that it's a better working height. I'm gonna put this down. So I've got all my supplies. First, before I put my gloves on, I'm going to prepare my tape. I'm going to put on my gloves. Okay, so first I'm going to inspect the nares. So I'm looking for any obstruction or deformities. Have you ever been injured have you ever injured your nose? Alright, I'm just raising the bed a little bit more. Okay, I'm gonna close one nostril and have you breathe out. Okay, and the other side. So, I have verified patency. I verified patency and okay, so now I am going to measure my tube. Oh, I need to check for gag reflex here, Joe. Okay, gag reflex is intact, and I'm going to measure the tube starting at the tip of the nose to the ear and then to the xiphoid process. And I am going to take my piece of tape and measure. And measure that. I'm going to just kind of roll like this just to get it in a good curve for that. Alright, Joe, I'm just going to uncover your covers. I'm going to place a linen saver. I'm going to give you a tissue and your emesis bin and then your water. So today I am using a water soluble lube and making sure that all of this is intact. I'm going to place the pillow more so under the back so that Joe is able to hyperextend more. Alright, so you're gonna feel some discomfort and okay, so I have prepared the tube with lube. I could also place it in warm water, but I've coiled it a couple times to get it in a better configuration than what it's in. And I have my tube marked. I'm going to use the left nostril because on this mannequin, the left nostril works better than the right. Alright, Joe, you're going to feel some discomfort when I insert the NG tube. Your eyes might water, which is why I gave you a tissue, and your emesis bin in case you have to throw up. Once I pass your throat, you might gag, so then I'll have you drink some water. And if at any time you need me to stop, just raise your left hand and I will stop. Alright, I'm inserting the tube. Oh, I'm just gonna help you extend there. Alright, good job. Alright, Joe, I'm gonna have you drink some water while I continue inserting. Okay. Alright, now that it is in place to the tape, I am going to secure the tube to the nose. Okay, I'm just going to move this down here, and then I have another piece of tape to secure to the gown. Making sure he has enough room to kind of move around. Okay. Now, to ensure placement, I am going to grab my emesis bin and my syringe, and I have the tube clamped in my hand. I'm going to unplug it. Oh, sorry, that was kind of hard. And I'm going to aspirate some gastric juices. And I'm going to reclamp that. And I would test it with my pH strip. And it needs to be within 1 to 5.5. Or we can x-ray or or test the Billy strip. Now I am going to connect to suction, low intermittent suction. Again, I'm going to clamp and then remove and instill. Okay, take off my gloves. All right. Now that your NG tube has served its purpose. I'm going to remove it. So I'm gonna put gloves on. I'm going to turn off my suction. And then I'm going to clamp the tubing and disconnect and then reconnect. I'm going to take this off the gown. And then I'm going to kind of wrap it like that. I'm going to hold it in place. Oh wait, before I remove it, I am going to instill 15 ml of air. Make sure this is on better. I'm going to instill 15 ml of air. And then Joe, I'm gonna need you to hold your breath when I say so while I remove the tube. So I've instilled air. I'm gonna remove the tape. Alright, Joe, take a nice deep breath and hold it while I remove the tube. Wrapping it all up in my glove while I remove it. And then discard it in my glove appropriately so that it's done. And I would clean Joe up.